A cigarette might look simple, but it's one of the most dangerous products ever created. It's made up of three parts: the filter, also known as the cigarette butt, the rolling paper that wraps around it, and the tobacco blend inside, made from dried and processed tobacco leaves and stems from the Nicotiana tabacum plant. When you light a cigarette, things get complicated very fast. The tobacco blend releases more than 7,000 different chemicals in the form of tiny particles and gases. As the smoke passes through the filter, some of the tar sticky, brown, partially burnt tobacco is trapped, but not all of it. Tar stains the smoker's fingers, teeth, and even the inside of the mouth and vocal cords. It irritates the vocal cords, triggering the familiar smoker's cough. From the mouth and throat, the smoke travels down into the lungs. The lungs are lined with tiny hair-like structures called cilia. Their job is to sweep away dust, debris, and bacteria to keep the airways clean. But cigarette smoke contains hydrogen cyanide, a poisonous gas that, along with tar, paralyzes these cilia. When the cilia stop working, toxic particles can move deeper into the lungs. Chemicals such as arsenic and benzopyrene, both known carcinogens, coat the lining of the airways and dramatically increase the risk of lung cancer. Once the smoke reaches the deepest part of the lungs, it enters the alveoli, the tiny air sacs where oxygen is transferred to the blood and carbon dioxide is removed. Under normal conditions, oxygen binds to a protein called hemoglobin in red blood cells, which then carry it to every part of the body. But cigarette smoke also contains carbon monoxide, a poisonous gas that competes with oxygen. It binds to hemoglobin more strongly than oxygen does, pushing oxygen out of the way. As a result, the body cells receive less oxygen and begin to starve. These oxygen-starved cells send distress signals, which trigger inflammation. The increased inflammation causes swelling and mucus buildup, narrowing the airways and making it even harder to breathe. The damage doesn't stop in the lungs. Once the chemicals from cigarette smoke enter the bloodstream, they travel to every organ in the body. Cigarette smoke contains highly reactive oxidizing chemicals that damage the walls of blood vessels. This inflammation leads to the formation of fatty plaques that narrow the arteries, restricting blood flow. When these plaques block the arteries that supply the heart or brain, the result can be a heart attack or a stroke. A heart attack occurs when part of the heart muscle dies to lack of oxygen, while a stroke happens when brain tissue dies for the same reason. Both are life-threatening and can lead to permanent disability. Even worse, toxic metals such as arsenic and radioactive substances like polonium travel through the bloodstream, spreading their damage to other organs. They increase the risk of cancers beyond the lungs, including cancers of the skin, liver, kidneys, and bladder. Every puff of cigarette smoke exposes the body to a chemical cocktail that attacks it from the inside out. So, if smoking is so harmful, why do people keep doing it? The answer lies in one powerful chemical, nicotine. Within 7 seconds of inhaling cigarette smoke, nicotine-rich blood reaches the brain. There, nicotine attaches to special receptors called nicotinic acetylcholine receptors. This triggers the release of dopamine, adrenaline, and serotonin, brain chemicals that make you feel alert, focused, and even relaxed for a short time. It's this surge of brain messengers that makes smoking feel rewarding, but the effect doesn't last. Nicotine is broken down in the liver and leaves the body through urine within a few hours. Once it's gone, the brain starts craving that chemical rush again. Cravings can start as soon as 2 hours after the last cigarette, leading to restlessness, irritability, anxiety, frustration, and trouble sleeping. Over time, the brain develops a tolerance to nicotine, meaning the same amount no longer produces the same feeling. Smokers need to consume more and more nicotine to feel normal, creating a vicious cycle of addiction. The thousands of chemicals in cigarette smoke don't just cause cancer, they affect nearly every part of the body. Long-term smokers often develop emphysema, a condition where the alveoli walls break down, making it difficult to breathe. The skin loses elasticity and becomes wrinkled due to reduced blood flow and oxygen. The sense of taste and smell dulls. In men, smoking can cause impotence by damaging blood vessels and reducing circulation. In fact, tobacco is the only legal product that kills up to half of its users when used exactly as intended. Statistics reveal how deep this issue runs. In the United States, over 95% of smokers start before the age of 21. And in Australia, the average smoker consumes about 93 cigarettes per week. That's 4,836 cigarettes every year. Imagine spending that much money enough to buy 4 brand new iPhones just to harm your own body. And that doesn't even account for the emotional cost of addiction or the toll it takes on families. But there is good news. The number of smokers worldwide is steadily decreasing. Awareness campaigns, stronger tobacco control laws, and access to information on the internet have empowered millions to quit. Younger generations are growing up more informed and more resistant to tobacco marketing than ever before. With the right support, determination, and education, we could one day see a world free from smoking. Quitting is never easy, but even thinking about it is a step in the right direction. The moment you stop smoking, your body begins to heal. Within 20 minutes, heart rate and blood pressure start to drop. Within 12 hours, carbon monoxide levels in the blood return to normal. Over the following weeks and months, circulation improves, lung function increases, and the risk of heart disease and cancer gradually decreases. Every day without a cigarette is a small victory for your body. Cigarette smoking is not just a bad habit, it is a deadly addiction driven by a powerful chemical and a deceptive sense of relief. The truth is simple: tobacco kills, even when used exactly as designed, but knowledge is power. The more we understand what smoking really does to our bodies, the easier it becomes to make the choice not to start or to stop for good. So, if you're smoking and even thinking about quitting, remember you're already halfway there. Make the decision today. Your lungs, your heart, and your future self will thank you.